Welcome to part 2 of our interview with Dr. Gordon Reid. We're going to be looking at his entry into Parliament, affordable housing and aged care. You've moved from being a medical practitioner into being the MP for Roberson. So how did that change happen and how have you felt that change happen?
Yeah, of course. So I suppose just to start, I still practice as a doctor on a pro bono basis in the emergency department. But I'll give you the not so short version of why I got into politics, because most people wonder, why did you go from the most trusted profession into one of the least trusted professions? I suppose one of the things that I consider is when I'm working as a doctor or practicing medicine, my impact can help one patient or can help one family, whereas in my new role as part of a government, or as part of the Parliament, I should say, our reach and our effect and our impact is felt by thousands, if not millions of people. We've passed legislation recently like the Cheaper Medicines Act to lower the price of medications, which impacts thousands of people on the Central Coast and millions of people across the country. And that's sort of part of the reason I made the jump to become a parliamentarian. And I give a story of a shift that I had at one of our hospitals here on the Central Coast. And it was in the emergency department. It was between two of the outbreaks, two of the COVID outbreaks that were occurring, two of the peaks. So we were still seeing people come in with COVID and we were all still in PPE and COVID patients were still coming through the door, but we were also seeing a significant amount of patients coming because they were fleeing family and domestic violence. They couldn't afford to get into social or affordable housing, or they were still waiting for social and affordable housing, or they couldn't get into emergency or crisis care. People couldn't afford food, they couldn't afford their medicines. With medicines, they're rationing it every second or third day, meaning that chronically controlled conditions like high blood pressure or high cholesterol were becoming heart attacks and strokes. People couldn't afford their blood thinners, so they were developing clots or strokes. So there was that. People couldn't afford to see their GP or couldn't get access to their GP in a timely fashion. And I think I was having shifts like that repeatedly over and over again. And the way I thought of it was you could either complain about it or you can try and do something about it. And I'm under no illusions that I can change. You can't change the world overnight, and you're not going to be able to fix every problem, but you can give it a red hot crack.
But it's important to have a voice who understands that.
To have a voice, and sometimes and often the Central Coast is the poor cousin of the East Coast of New South Wales. I've lived here and grown up here and know that. You've lived here and grown up and known that. That's to me that's always been the case. And I thought, well, I can be loud and annoy people on people's behalf. That's why I'm here. It's all about advocating. Medicine's about advocating for your patient, and this role is about advocating for your community. And I think that I know that the skills and the knowledge that I've developed by living here and by practicing medicine, I could adapt and apply into parliamentary life. And so I volunteered. I put my hand up to run as Labor candidate for the seat of Roberson, and that began the election campaign for the last federal election, which we all remember. And I had a great team behind me.
So Labor, a lot of people would probably think that a doctor running for Labor would be a contradiction. Most doctors would be on the Liberal side. Why Labor? What's important about Labor?
I think, and obviously everyone's entitled to their own political view and their affiliation with their own political party. I suppose I've always been of the opinion that you need to be socially progressive, whether that's in healthcare, whether that's in climate, whether that's in energy, but you need to be fiscally responsible about it. So you can have these ideas and you can have these forward-thinking progressive ideas, but you need the ability to pay for it. And like I said, education, climate, energy, education, healthcare, all of that, you need a way to pay for it. And that's what Labor is. Labor's the party of big things. We're the party that does things. You look at the NDIS, you look at Medicare, you look at what we're doing now with the Affordable Medicines Act. We've put legislation through for the National Reconstruction Fund to make Australia a country that makes things again like we used to be. The Safeguard Mechanism and the Powering Australia plan, acting on climate change, enshrining things into law so that we act on that. Labor's always been the party that does things like that, progressing a referendum for the voice, the Aboriginal voice to Parliament. We've always been that party that's driven Australia forward, and we've brought everyone with us, regardless of whether you vote Labor, Greens, Liberal, National, whatever it might be. If you voted for us, thank you for your support, and we'll bring you along. If you didn't vote for us, we hope that we'll win your support in the next round, but we'll bring you with us too, because that's what Labor's about. It's about everyone. It's about the whole community.
So in 2021, you spoke about affordable housing being one of the biggest crises we have, particularly here on the Central Coast. Mm-hmm. So what have you been doing in Parliament to try and fix that?
Absolutely. So I'd first like to acknowledge that housing is a real housing supply, housing affordability, and access to housing is a huge issue right across the country, but also here on the Central Coast. It's never been more expensive to own a home. It's never been more expensive to maintain a home and to access a home. One of the things that the Albanese Labor government took to the election was the Housing Australia Future Fund. And what that involved was an off-budget investment into the Future Fund of Australia, and then the return on that investment would then fund the construction, particularly of social and affordable housing. And then part of that would be earmarked for at-risk groups. So women and children fleeing domestic violence, Indigenous people who are homeless or at risk of homelessness, veterans who are homeless or at risk of homelessness, and the fastest growing group of homeless people in Australia, women over the age of 50 in low income brackets. So that's the basics of what that looked at, along with the repair and construction of emergency accommodation and crisis accommodation. That bill, under Minister Julie Collins, the Minister for Housing and Homelessness and Small Business, passed through the House of Representatives, and it's now in the Senate undergoing negotiations. And what I would say to my colleagues right across the Parliament is that this policy, the Housing Australia Future Fund, is supported throughout the business community. It's supported throughout the community. The people of Australia voted for this policy. This was a policy we took to the election and that we have a mandate for. And it's so important that we act on housing now. I don't need to tell you, we're in crisis mode with housing.
In crisis mode.
So this will be an important first step. It's one of the nation's largest investments into social and affordable housing. It's making sure that, we have that infrastructure there for the future, so that it can continue to be used by our community. So, and when you have stable housing, whether it be social, whether it be affordable, whether it be private, if you have stable housing, there's only beneficial flow-on effects from there. If you've got a roof over your head, we know from the data that you're more likely to hold down a job, and you're more likely to be able to access services and the like. So I think it's really important that we focus on housing. It's a big focus of mine. It's a big focus of members of the community here. Clearly, a big focus of yours. And
very big focus.
I'd like to see it passed.
So on the coast, you definitely hear an undertone of people saying, if we stop people coming here, we won't have the housing crisis here. Is that something you see, that stopping people coming would stop a housing crisis, or is there a fundamental issue across the board?
So look, I think what makes the coast and what makes the peninsula a great place to grow up, a great place to live, is the diversity and the vibrancy in the community. People coming from all corners of not just Australia, but all corners of the globe to call the peninsula and to call the Central Coast their home is what has made this place a great place to grow up, a great place to be educated, a great place to stay and to live and to learn. Yeah. I think where we need to focus is on the construction and the investment in the infrastructure that's going to benefit the community as a whole. Like we've just spoken about the Housing Australia Future Fund. It's making sure we're investing in social and affordable housing. We were able to secure in the budget multiple investments for roads. So that's both local roads and state roads, to widen Avoca Drive, to upgrade Avoca Drive, to repair and renew some of our local roads, upgrade our local sporting facilities like the one at Frost Reserve in Kincumber. I think we need, as our population grows here on the Central Coast, we need to make sure that the infrastructure keeps pace and the infrastructure grows. Yeah. Also with the addition of the urgent care centre. So if you're too sick for the GP, not sick enough for the emergency department, normally you don't have anywhere to go. Lots of other countries have that model of care. I'm going to nerd out as a doctor for a minute. normally don't have anywhere to go. Places like New Zealand, places like the UK have that middle level care. So I'm talking the fracture of the arm at Saturday or Sunday sport that needs a plaster but doesn't need surgery. This would be somewhere you'd go. Or a cut that you need stitches for. That'd be somewhere you'd go. Dobell, the electorate in the north, and Roberson here, we're getting 2 on the Central Coast. The tender process has already gone out. To start that process. Mark Butler, the Health Minister, was here just recently to get that up and running. It'll be a bulk build clinic for adults and children with extended operating hours designed to take pressure off our GPs and our emergency departments. So it's not just about focusing on one type of infrastructure to cope with our increasing population. It's making sure that we're not siloing and we're broadening what we're looking at. Healthcare, roads, housing, sporting facilities, recreation facilities and the like. And making sure too that we're working together with all tiers of government. That's really important for an area like the coast. So making sure we're working well with the Central Coast Administration, making sure that we're working with our state members of all political persuasions and also our federal members as well, because that's what Team Central Coast is all about.
So one of the other things which I see, my grandmother lived in Booker Bay just down the road here. And that whole suburb's changed and it's all Airbnbs nowadays. So a lot of the housing stock is now taken up through that holiday Airbnb style of housing. And the peninsula is a big place for that. Is there some way we can sort of manage that, not overtaking and taking out of pure residence just for a holiday house?
Well, and I think this goes back to the original point that I was making about investing in social affordable housing and making sure that we have that infrastructure there right across the country with the Housing Australia Future Fund. And it's also then working with our state colleagues, so the likes of Lisa Tesh and Adam Crouch and David Harris, David Meehan and Yasmin Catley. And Emma McBride, my federal counterpart to the north, and Pat Conroy, who's the bottom third of his electorates on the Central Coast. It's making sure that we're all working together to make sure that people can get access to a home and can get access to a roof over their heads. So that's a complex issue and the reason that the Housing Australia Future Fund is so important.
All right. Team Central Coast, it's one of your hashtags which you run a lot and you just ran through a big long list of people which you're all working together. Well, what is that trying to achieve and is it seeing the results? Because I believe it is, but what's your view?
So I always talk about our Central Coast family and Team Central Coast. And the reason that I do that is I think over a period of time, we've lost that sense of community and that sense of togetherness, and COVID really exacerbated that problem. We were isolated, we were locked down for important reasons, but what we did lose is that sense of whole and that sense of we're one big family, we're all in this together, we are one Central Coast, and we need to go to Canberra, we need to go to Macquarie Street as one Central Coast because that's how we achieve the outcomes for our people. So when I say lines on social media like Happy Friday Team Central Coast, or when I'm writing cards or letters to people thanking them for the work that they do for our Central Coast family, I'm trying to instill that sense of togetherness, that sense of community. And I think in my position, the privileged position that I have as a community leader, as an elected representative, is to try and foster that and to try and nurture that and hopefully see it spread throughout our region. Because we are stronger when we're together, where you need to be the sum of many parts to get something done. You can't be fractured and fragmented.
I agree wholeheartedly. That's the end of part 2 of our discussion with Gordon Reid about his time in Parliament so far and some of the things he's been working on. In our next part, we'll be talking about the voice to Parliament. Please join us.